How long do I isolate after thyroid iodine uptake? After a radioactive iodine uptake test, you usually do not need to isolate yourself. The test uses a very small amount of radioactive iodine, which means the radiation exposure to others is minimal. The dose in this test is much lower than in treatments that use radioactive iodine to treat thyroid conditions. Because of this, you can typically go about your normal activities shortly after the test, often within a few hours. You do not pose a significant radiation risk to family members or the public, so no special precautions are generally necessary. However, if you are undergoing radioactive iodine therapy, which involves a higher dose of radioactive iodine to treat conditions like hyperthyroidism or thyroid cancer, the situation is different. In this case, precautions are needed to protect others from radiation exposure. The length of time you need to stay isolated can vary depending on the dose you receive and your individual circumstances. Usually, the recommended isolation period ranges from about 3 days to up to 2 weeks. During this time, you should avoid close contact with others, especially children and pregnant women. Maintaining a distance of at least 6 feet from others is advised, and it is best to sleep in a separate bed. You should also avoid sharing utensils or preparing food for others, and follow hygiene measures such as flushing the toilet multiple times after use to reduce radiation spread. Your healthcare team will give you specific instructions based on your treatment dose and personal situation. It is very important to follow their guidance carefully to ensure safety for everyone around you. Remember, the goal is to minimize radiation exposure to others while allowing you to recover comfortably. In summary, after a radioactive iodine uptake test, no isolation is needed, and you can resume normal activities within hours. But after radioactive iodine therapy, isolation might last from 3 days to 2 weeks, with precautions to keep others safe. Always check with your healthcare provider for advice tailored to your specific treatment and circumstances. They will give you the best guidance to keep you and those around you safe and well-informed.